Good morning. I'd like to welcome you to today's conference, Perspectives on Climate Change and Public Health. I'm Revesz. I'm a professor and the former dean at NYU Law School, and I direct the Institute for Policy Integrity, which is hosting this conference, along with the State Energy and Environmental Impact Center. I'm delighted that so many of you are here online this morning, though I wish that times were more normal and we could get together in person. The Institute for Policy Integrity has hosted an annual fall conference each year since our inception in 2008 in order to spur conversation on policy issues that we see as especially timely and important. We're delighted to work with the State Impact Center to convene today's event. It was so wonderful to get to plan this conference with my NYU colleague, David Hayes, who has played such a leadership role on these issues over several decades, with Melissa Hoffer of the Massachusetts Attorney General's office, who is such an important figure in the very successful efforts by state attorneys general to fight the destructive policies of the Trump administration, and with Dr. Stewart Harris of the Harvard Medical School, who has taught me so much in recent months about the power of narratives in the climate change area. As our enormously distinguished speakers will discuss today, it is crucial for scientists, policymakers, healthcare professionals, and advocates to pay far greater attention to the threat that climate change poses to public health. Even though the pernicious effects of climate change on public health are staring right at us, opponents of regulating greenhouse gases have over the last decade pushed a false narrative that environmental law has taken a wrong turn in concerning itself with climate change as opposed to on environmental problems that have public health consequences, such as air and water quality. But they then oppose regulations to protect air and water quality is a topic for another day and perhaps another conference. Those of us who regard climate change as the existential threat of our times have not done a sufficiently good job in making the case that the distinction pushed by climate change opponents is spurious. The effects of climate change are very much effects on public health. For starters, consider the injury asserted as the basis to gain standing in Massachusetts versus EPA, the landmark case in which the Supreme Court held that greenhouse gases are air pollutants for the purposes of the Clean Air Act. The asserted injury was that Massachusetts would lose coastal lands, not that increasing heat events would lead to additional hospitalizations, increasing the pressure on public hospitals and cost of the Medicaid program. Or consider all the attention that environmental organizations pay to the possible extinction of polar bears as a result of climate change. Think how many of us have gotten powerful fundraising appeals based on images of polar bears. Obviously, we should be concerned about the possible extinction of polar bears and other fauna and flora, but we need to pay considerably more attention than we have until now on the effects on human mortality and morbidity. There are experts who can tell us whether money could be raised with images of diseased lungs or people on ventilators. We need to drive the narrative and not allow the narrative to be dominated by climate change opponents. By the time climate change became a visible issue in our consciousness in the 1990s, we were already operating under a significant disadvantage. US environmental law, despite all its successes, suffers from an original sin: the very broad grandfathering of existing sources from the stringent standards of the Clean Air Act. The result is that coal plants that had been close to obsolete in the 1970s have continued to operate well beyond their lifetimes. In some cases, they're on their third lifetime because they didn't need to invest hundreds of millions of dollars on scrubbers like new plants. I explore this issue in a book, Struggling for Air, co-authored with my policy integrity colleague, Jack Linke. And opponents of climate change regulation have seized on a human narrative that turned out to be quite powerful: displaced coal miners. They ran the 2016 presidential campaign in significant part on a war on coal rhetoric, despite the very tenuous connection between the plight of coal miners and environmental regulation. And to further extend the life of obsolete plants, opponents of climate change regulation are trying, as we speak, to attack the reliance on indirect benefits or co-benefits to justify climate rules. The opponents understand, of course, that most climate change regulations, in part by shifting energy production away from coal, have enormous co-benefits in the form of particulate matter reductions and want them to go away. Our goal is that all of us come to see today at 1 p.m. not as the end of a successful conference, but as the beginning of an ambitious effort to effect a significant repositioning of how climate change is framed in public discourse. For those of you who are not familiar with Policy Integrity's work, we are a nonprofit, we are a non-partisan think tank dedicated to improving the quality of government decision making. We engage in research and advocacy in the fields of economics, law, and regulatory policy. And we bring our expertise to bear principally in the environmental, climate change, and clean energy fronts. For instance, our research and related advocacy on the social cost of carbon has helped make the benefits of climate change policies more measurable. We have published several important articles, including one co-authored with Nobel Prize winner Kenneth Arrow, and have led a coalition of major environmental groups in submitting comments encouraging the use of the social cost of carbon in all federal regulations that affect greenhouse gas emissions. Our most recent victory took place in a California federal court, which overturned the repeal of a methane emissions rule because the Trump administration applied improper, unsupportably low social cost of carbon values, failing to consider the full climate impacts of the methane rule's rollback. We have also worked to promote intelligent energy policies at both the state and federal levels that properly account for the benefits of reducing both greenhouse gas emissions and conventional air pollution. A great deal of our research and related advocacy has focused on the health implications of air pollution regulations. And we've taken a strong position defending the role of co-benefits against the spurious arguments to the contrary raised by the Trump administration. The Trump administration's disregard for public health has been especially pronounced in recent months during the pandemic, and we've worked to call attention to the policy failures that must be addressed. In this connection, over the summer, we published a report that looks closely at the connections between the administration's deregulatory agenda and the impacts of the pandemic. Weakening our defenses, how the Trump administration's deregulatory efforts has exacerbated the COVID-19 pandemic. A report reviewed the major categories of COVID-19 risk factors: poor living conditions and working conditions, air pollution, and poor access to healthcare, and identified the regulatory delays and rollbacks that exacerbated these conditions. I'd now like to introduce David Hayes, who in turn will introduce our keynote speaker, the Honorable Maura Healey, Attorney General of Massachusetts. David directs the State Environmental and Energy Impact Center at NYU, which is co-hosting this conference with us. He is also a professor at NYU Law School and previously served as Deputy Secretary at the Department of the Interior during both the Clinton and Obama administrations. One of my real privileges over the last few years has been to watch from close by the extraordinary work that David has done running the center to support attorneys general in defending and promoting clean energy, climate, and environmental laws and policies, and bringing attention to their enormous success in stopping the enormously pernicious policies of the Trump administration. Thanks again to all of you for being here today. I'll now turn things off to David.
Thank you, Ricky. Thank you once again for your always over-the-top graciousness. So I just want to introduce quickly the State Impact Center and get to Maura Healey, our keynoter. So our State Impact Center at NYU is formed in 2017 to support state attorneys general in defending and promoting clean energy, climate, and environmental laws and policies. We are nonpartisan and work with all AGs who advance the cause of climate, energy, and the environment. In that regard, we've worked with the Attorney General community to address climate change in a variety of ways, including supporting state clean energy policies that are leading our country's efforts to transition toward clean, climate-friendly energy. It is in that context in particular that we have seen many state attorneys general draw the direct connection between the climate threat and the health and welfare of their constituents. Attorney General Maura Healey has been a leader in that regard. In May of this year, she released a groundbreaking issue brief that connected the dots between COVID-19's devastating impacts on disadvantaged communities in Massachusetts and the health vulnerabilities that those communities face because of the twin insults of direct climate-driven health impacts like extreme heat and the unhealthy legacy of living adjacent to polluting industrial complexes and highways. Her work inspired our State Impact Center to put on this conference with Ricky and the Institute for Policy Integrity. To further advance the knowledge base of the connections between climate and health, we have just put up on our website a new resource for attorneys general and everyone who is interested in this issue. Here's a shot of our new webpage entitled Climate Change and Public Health. As you can see, we have separate sections on the health effects of climate change, the health effects of burning fossil fuels, which of course cause climate change, environmental justice, and the Trump administration rollbacks. We'll also be posting information about this conference on the website here. So I hope that all of you will use this website as a resource. As you'll see, it's heavy on science, law, and policy, exactly what this conference is all about. Before providing a fuller introduction for our keynote speaker, I want to call out two other individuals who inspired Ricky and me to go forward with this conference. Ricky mentioned both of them. Melissa Hoffer is first, and she's the head of Maura Healey's Environmental and Energy Bureau. She's a skilled lawyer who's passionate about people, health, and the environment. She connected the dots between climate and health before many of the rest of us and has acted on it. She's an inspiration for me and for many in the Attorney General community. And Melissa introduced us to Dr. Stewart Harris, who also deserves a shout out for willing this conference to happen. Stewart has organized and is leading our second panel composed of health experts like him, and I'll give him a proper introduction then. Finally, thanks to the staffs of Policy Integrity and the State Impact Center, particularly Sydney Calapi, who has worked for months on the content for our climate change and health webpage and has been working tirelessly on the logistics for this event. Now for our keynote speaker. Maura Healey is in her second term as Massachusetts Attorney General, continuing a career spent fighting for justice and equal rights by serving as the people's lawyer. As Attorney General, Maura has focused on confronting the devastating opioid epidemic, reducing gun violence, enforcing civil rights, and protecting consumers. She's also championed access to healthcare and reproductive freedom. But I know Maura best for her work in addressing the climate crisis. She's been a pace setter in the AG community for recognizing the connection between energy and the environment, and more specifically, between the imperative to transition to clean energy and the promotion of human health and environmental health. She's focused simultaneously on enforcing state and federal environmental protection laws, stopping the rollbacks of critically important restrictions on climate pollution, and ensuring that Massachusetts consumers have access to clean, reliable, and affordable energy by advocating for ratepayers in state and federal proceedings. Maura is a graduate of Harvard College, after which she spent 2 years overseas as a starting point guard on a professional basketball team in Europe. She received her JD from Northeastern University School of Law, and it's my honor and privilege to introduce you as the keynoter for this conference.
Well, good morning, David. It's so good to see you. I want to thank you for our partnership and all of the work that you do. The center is really something, and once again, we're pleased to be able to be here today and partner with you. So I want to thank you. I also want to thank, of course, NYU and Professor Ricky Revesz. Thank you so much for bringing us all together and hosting. It'd be nice to be in person, but it's wonderful that we're able to do this virtually, and maybe that enables even more people to tune in. I also note and want to extend a special welcome to my friend Gina McCarthy, who started her career working at the intersection of public health and the environment, and she's just done so much to keep public health at the forefront of her work on environmental and climate protection, and we were proud to claim her as a Massachusetts resident. I'm also really happy to be joined today by Dr. Stewart Harris of our own Mass General, who worked with my team in NYU to organize today's program. Dr. Harris, we're honored to have you here today, and we thank you for your incredible service as an ER physician throughout the peak of the COVID-19 outbreak in Massachusetts. And my deep thanks goes out to all of you, healthcare professionals who have been caring for so many and who have been really dealing up front with the pains of this pandemic. Nearly 200,000 people have died in this country. There are others who've needed your care and comfort under the most grueling of circumstances. And we want to thank you for your courage and your heart and your stamina and your example. I also want to give a particular thanks to my team who contributed to today's event, Maria Hardiman and Pearl Strand on our digital team, who produced the video we'll be sharing with you this morning, Mary Beckman, Chief of our Healthcare Bureau, Christophe Courchain, Chief of our Environmental Protection Division, and most of all, to my colleague Melissa Hoffer, who, as David said, is Chief of our Energy and Environment Bureau and really has taken us forward, not only as an office, but Melissa Hoffer is the leader among leaders when it comes to AG's offices. And I want to thank you, Melissa, for your innovation and for so long now on so many fronts. And this is such a critically important topic. We've seen the importance of this topic in recent months in particular. And I want to thank you for working once again to bring us to this place of really important work and really important effort. You are an outstanding lawyer and a leader, and I am grateful to you for making this possible today. So we've got a great lineup. As I say, we're really so fortunate to be joined in a short bit by Gina McCarthy, and I look forward to hearing from Dr. Stewart Harris. But let me kick this off by presenting a short video that our team put together that talks a little bit about how doctors are directly experiencing how climate change is showing up in their clinical practices and what the implications are for our healthcare professionals and how climate change policy is healthcare policy. So let's tune in.
So I've been thinking about climate change for a while. I think many of us have. And at times it's easy to think of this as something in the distant, out there. At some point, we may have to address it. It is today. It is in my clinic. It is in the hospital where I work. It is in my community where I live.
Hi, my name is Dr. Jay Lemry. I'm an emergency physician and I work at the University of Colorado School of Medicine.
My name is Ashish Jha and I am the Dean of the School of Public Health at Brown University.
I'm Jonathan Patz. I'm a professor and director of the Global Health Institute at the University of Wisconsin in Madison. I first became aware of climate change back during my Master's of Public Health program. I looked into this and I thought, this is a big deal. You know, this is air pollution, population policy, energy policy, and just was an enormous issue that had potential health impacts.
Fossil fuels are dirty fuels and they cause asthma and cardiovascular disease and strokes. Getting off of those fuels and moving towards cleaner energy has these profound effects on our lives that I think we've got to make that transition, not just to run away from something, but towards something else that I think is going to be much, much healthier and better for everybody's health and well-being.
In terms of a patient story that I could share, I work in Colorado and the wildfires in the American West have been prolific this whole summer. And one of the things that we're seeing is patients with pre-existing lung disease, COPD, congestive heart failure, asthma. And when we see our patients and treat them, we write down the cause of their chief complaint. But I don't write down air quality really bad in Colorado. That's so important because there is a cause and effect there.
A couple of summers ago, I took care of a patient, a Vietnam veteran who was hospitalized, basically found at home confused, unable to take care of himself. We very quickly realized that the two things were happening. One was that he was profoundly dehydrated. Boston was suffering an unusual heat wave, and he was on medicines that complicated his fluid management because of cardiovascular disease that he had. And one of the things that we realized at that moment, the number of heat waves, the number of hot days hitting us in Boston is changing. And it's changing in ways that need for us to change our clinical practice. We have to really think about the medicines we're giving our cardiac patients. patients and think about how they interact in a new climate. When he passed away and talking to his family about his life and his surviving the jungles of Vietnam, and his wife actually brought up the point. She said, after all of that, he succumbed to a heat wave in Boston. And I thought, this is the new reality we're living in. And as clinicians, this is not some theoretical. This is something we have to start taking into account into our clinical practice on a day-to-day basis.
It's impacted me as a caregiver. It's frustrating, right? I know the air quality is being degraded, and I see patients who are very vulnerable physiologically coming in with exacerbations that are directly caused by environmental consequences.
So this is not something that's new. I do believe it is essential for physicians to learn about the principles of climate change and how climate change is going to change clinical practice. And then I think it's essential for physicians to advocate for policies that protect our patients by reducing greenhouse gases and ultimately mitigating the negative effects of climate change.
Climate change is a health issue, and physicians really are the right people to be communicating the importance of climate change because it cuts across so many exposure pathways to affect our health. It's absolutely paramount for doctors and nurses and all health professionals to step up and call out climate change for what it is. It's a health emergency.
I work in a community that's underprivileged. It's a poor socioeconomic community, and we're definitely seeing disparities with people of color and socioeconomic vulnerabilities coming in with shortness of breath, from the poor air quality out here.
Here in Madison, Wisconsin, we have many people that live in poor housing with poor ventilation. It may be in flood-prone areas. We've seen major flooding in the Midwestern United States, and the issue of moldy basements, and we see increases in asthma. So I've seen in this community many people that are affected by climate, and especially from flooding and mold exposure.
So patients have been coming in with shortness of breath, often patients with physiologic vulnerabilities, so pre-existing asthma, congestive heart failure, obstructive pulmonary disease. And when they come in, they're not feeling good. They're short of breath. They can't get a reasonable breath of air. They're speaking in short sentences, or even just short word phrases, and they feel miserable. This is something that has really affected people out here.
That I believe climate change is the biggest public health challenge of the 21st century. If we do not tackle it, it will profoundly shape the health of populations locally in Massachusetts and Rhode Island and New York, nationally across the US, and globally across our entire planet.
This should become mainstream in medicine. The effect of climatic extremes, be it from heat waves and worker stress to effects of climate on aeroallergens and ragweed pollen that affects childhood asthma. These are absolutely bread and butter health issues, and climate change should not only be part of the medical school curriculum, but anyone in the healthcare system really needs to step forward and speak to climate change for what it is, a health emergency. Nurses and doctors are the most trusted messengers about climate change. Climate change, it's here, it's now, it's affecting us. It's a health crisis, but it's solvable.
This is not just one of the issues we need to deal with. This is arguably the most pressing public health issue of our times, and we've got to get going on action now.
Okay. Well, hi, everybody. We're so grateful to Dr. Harris, who conducted those interviews, and Drs. Lemery, Patz, and Ja for sharing their remarkable insights and experience. I'm really struck by their stories and the power of their call to face the truth of the moment. Now, those stories represent the realities of millions of people across our country. Just in the past few weeks, catastrophic climate change events have captured headlines across the country. We can see in real time the horrific human suffering as these disasters unfold. Unforgettable images on TV of twisted grain silos and blasted trees in Cedar Rapids, where a series of violent windstorms toppled millions of acres of corn and soy in our nation's breadbasket. Mile after mile of homes and businesses damaged and destroyed in Hurricane Laura. Homes underwater in Pensacola after Hurricane Sally dumped 2 feet of rain and the eerie orange sky over California from a West Coast fire season so off the charts, the front page of the LA Times headlined it, California's Climate Apocalypse. The public health emergency that is climate change is here. Because fossil fuel companies like ExxonMobil deceived the public about climate change, we lost 40 years we could have spent transitioning to clean energy and avoiding the impacts we see today. But here we are. So we have to reduce our emissions at warp speed while we also adapt to dangerous levels of warming that have already occurred. And that places you, our healthcare professionals, front and center in this moment. Our window to act, we know, is closing, but you and I know there is much we can do to keep this crisis from getting even worse. I think for far too long, if people thought about climate change at all, they thought about polar bears and melting glaciers and charts showing rise in CO2. Now that's all important, but those images have not really helped people to understand the reality and the magnitude of the threat we face. Now I think healthcare professionals, you all, can change that. Many people still don't understand the links between the health of our families and the climate-driven weather events and related hazards. The sustained drought in California killed over 150 million trees that are now fueling the fires that pollute the air with millions of particles, the air that people are now forced to breathe, air that is so hazardous in some places, it's off the EPA scale. Storms like Hurricane Harvey, which dropped over 1 trillion gallons of rain on Houston in 4 days alone, are made even worse by climate change and leave epidemic mental health crises in their wake. A Rice University survey found that fully half of Houston area residents were struggling with debilitating emotional distress following Hurricane Harvey. And as you heard in the video, more extreme heat waves are claiming the lives of our most vulnerable neighbors and family members. And in so many ways, that's what this moment in our history is about, breaking through the denial and telling the truth about climate change, the truth about the deep structural racism that is still so much a part of the fabric of American life, and the truth about how that plays out, so painfully evident in the communities hit hard by climate change, COVID-19, poverty, and health disparities. Now, many have drawn parallels between the federal government's heartbreaking and lethal mismanagement of COVID-19 and our response to climate change. Critical windows to act were lost because science was denied, and climate change and COVID-19 were deemed hoaxes. We failed to adequately protect ourselves and face the threat head on with the best policies and planning because too many in positions of power refuse to listen to the advice of our medical experts and epidemiologists. Just as the increasingly urgent calls of the world's leading climate scientists were for so long also ignored. And COVID-19 is much more deadly, of course, to Black, Brown, Indigenous, and immigrant communities because so many in positions of power and privilege were willing to tolerate the intolerable for way too long, structural racism and the burgeoning wealth gap. And those same disparities have already made the effects of climate change much worse for those communities. As David mentioned, back in May, my office, thanks to the leadership of Melissa and her team, put together a report that detailed the disparate impacts of COVID-19 in Massachusetts. Massachusetts has lost over 9,000 people to COVID-19. We rank 6th nationally for total COVID-19 deaths. Families across our state are still reeling from the devastating impacts of the pandemic, but none have been hit harder than our immigrant, Black, and Brown, and low-income communities, where there's been a public health crisis for decades. Now, COVID-19 exacerbated that crisis. Dr. John Levy of Boston University's School of Public Health analyzed data compiled and collected by our office. And that data showed that communities of color have the highest rates of COVID-19 infection across some of the largest cities in Massachusetts. In April, researchers at Harvard T.H. Chance School of Public Health issued a study linking long-term environmental pollution and COVID-19 death rates. Other factors, of course, play a role. Public transportation may be the only travel option for many people in these communities. Many are essential workers. Living situations may not be conducive to social distancing. There are language barriers, lack of access to health care, and a greater likelihood of having a serious chronic medical condition. These disparities, these social determinants of health, are the predictable endpoint of decades of policy choices that incentivize economic, housing, and environmental injustice. But the way I look at this is that if we created the policies that got us to this point, we can also change them. We can, and we are being called to create something new, and as Dr. Jha said, something much, much better. This is the opportunity we have. We can invest in clean energy jobs to promote economic recovery. You know, in Massachusetts, we employ nearly 100,000 workers in our clean energy economy. Clean energy is good for consumers, the climate, public health, and the economy. We can electrify our transportation and building sectors, prioritize rooftop solar in environmental justice communities, and improve energy efficiency in buildings to reduce pollution and lower costs for families. We have to fight to keep and then strengthen our federal environmental laws that protect health, including clean car standards, limiting methane emissions from the oil and gas industry, and carbon and mercury pollution from coal-fired power plants. We can strengthen requirements to protect our environmental justice communities. We can begin by establishing a better process for regulatory permitting and siting decisions. These things really, really matter, and we need to look harder and work harder on those issues. To do so, that means robust community outreach and participation, with project proponents funding community legal representation. If there are 3 words that capture this moment, it's these: I can't breathe. Those were the words George Floyd uttered 20 times as he lay dying with the knee of a Minneapolis police officer on his neck for over 8 minutes. Just one example of police brutality far too frequently targeted at our Black and brown communities. I can't breathe. These are the words we imagine so many of the tens of thousands of Black, Latinx, and Indigenous people in the US spoke as they died of COVID-19 at age-adjusted rates 3 times that of white people. Like the Dominican matriarch in New York City whose son worked at a local grocery store where he wasn't given a mask or gloves, whose daughter took the subway every day to clean one of the city's public hospitals. I can't breathe. And as you just saw, patients struggle for breath in ERs in California, Colorado, Oregon, and Washington, where catastrophic forest fires are choking the air with toxic pollution that's especially threatening to our most vulnerable, people with pre-existing heart and lung ailments like asthma and COPD, many of whom are people of color and immigrants. I can't breathe. What does it mean that so many literally and figuratively can't breathe? That the weight of our intertwined histories of racial injustice and environmental degradation now threatens our ability to live and thrive on this earth. For me, it means we need to be having a very different conversation that recognizes the relationship between health, climate, racial justice, and equity, and approaches problem solving through that lens. Seeing and making those connections so that in this moment of crisis, we lift up the possibility of radical healing. Radical healing of the systems that support racism and violence against Black and brown communities. Radical healing of the health disparities and inequities that force so many to choose between healthcare and medication, or paying for rent and purchasing groceries. Radical healing of the systems that put profit before people and the well-being of our environment. You know, as a lawyer, I think I went to law school because I wanted to make the world a better place, to protect and promote the public interest, to try to help people, to protect civil rights. You know, these are the reasons I and many went to law school. And as healthcare professionals, you chose a similar path to protect the most precious gift, the health of human life. Now is our time to build the world we know is possible. There's not a moment to waste. I want to thank you for having me. Again, I want to thank my team in the Attorney General's office for their work on litigations to reports to conferences like today. I want to thank my good friend David Hayes as well, and all of our wonderful participants. We can do this. I really mean it. We can do this. The time is now. We can do this. And I look forward to continuing the conversation today.